we should go ahead and start self-testing, just like pregnancy test, the way women will first do the pregnancy test at home before they go for confirmation and all of that. But we know there is a huge gap in knowledge around HIV, that when people hear the word HIV, they are first scared. When they know somebody is positive, they start whispering to each other, they start discriminating against that person. Based on of course, the earlier experience of HIV before it got to this level that is contained, but people need to get to know that much that they need to do in terms of knowing their status. Data is showing us that in Nigeria we have less than about a quarter of us knowing our HIV status. And you know, HIV test is not a one-off. It's something you do to check yourself, because if you know the route of transmission is not just, there are things we continually do. Yes, we can guard against them. You know, it could be transmitted through blood. A mother could pass it to the child. It could also be transmitted through sexual act, oral or anal. And if you look at some of this, of course, it could also be passed through infected sharp objects like syringes, blades, and all of that, and people still engage in all of this. So you know that it's something you need to continually check and be open to knowing your status, be open to accessing the services that are there. Also, the services are not quite at every point yet, because it's evolving. Yes, it's been decentralized to primary health care level, but we know that it's not in all of the facilities yet, and there are efforts to ensure that it's spread across and it also gets to very remote areas, hard to reach areas, so that people can actually get out there, get tested, know their status and manage it.
You still didn't talk about my question, which is talking about funding. You said that donations are reducing, and funding is a major issue in dealing with people living with this virus. So how are we going to deal with the funds issue?
I think basically what it means is like, of course, the funds we use currently is like 75% donor driven, and we know that government resourcing, yes, we put up the structure at federal, states, up to community levels. Community groups are also engaged, but I think it's everybody that would have to get up and play one part or the other. Of course, government resources, like I said earlier, I gave a breakdown of what goes into health sector. And HIV is not strictly health sector. One of the areas we're also looking at is everybody has a part to play. In terms of education, there is a government system in education which we work with for community engagement, for young people, for economic strengthening, social protection. I think it's everybody that would have to come on board to play one role or the other. The media, because a lot of the fear we have around HIV is people not having clear understanding of the science of HIV, how it's transmitted, what you need to do, updates on the current strategies to contain it and mitigate the impact. So I think in terms of resourcing, yes, government is showing leadership, providing some resources, but of course it's not enough, because all hands would have to be on deck. Like the motto for this year's World AIDS Day, which is internationally, it's all hands up for HIV prevention. But for us in the country, we have, because hands up could mean surrender or things like that, if you want to understand it in our own literary meaning. So for Nigeria, it's hands on for HIV prevention, because we believe everybody would have one role or the other to play, even individuals, because even malaria medication, people buy their artesunates without so much effort, and I think HIV needs to get to that point where even if it will be resourced centrally, people getting free medication, of course it will be for those that are indigent that cannot afford it. And for so many cases where people can actually afford it, you find out that people don't want to go up to a facility to queue up for their regime. They prefer to pick it up, even if they will pay to get it. And I think resourcing it would have to involve everybody playing their part one way or the other.
All right. Ms. Morris, you're of the international community of women living with HIV in West Africa. What would you say the situation has been like?
Before now, according to UNAIDS, it was recorded that there was a setback because we were dependent on donor, like she have just said, and in a project, it's expected that they run the project for a period of time and then stop for the government to take ownership. So that's an issue, taking ownership, one. Then two, the situation it's critical now because of this user fee attached.
User fee?
Yeah.
Can you explain that, please?
During PEFA, the American Presidential Emergency Plan, which I benefited from, I don't know what would have happened to my daughter. At that time, I had no job, couldn't pay for my accommodation. Feeding was an issue. So, because I went through the support group where I had to understand the need for me to find my way to the facility, I benefited from the prevention of mother-to-child transmission during that funding PEFA. APIN 2 has also played a very great role there, where they funded, they've been assisting peers for years. Then at that time, my delivery was free for a host of us, and so then we're breastfeeding. So we're given infant formula, to take our baby, that will last our baby for 2 or 3 months. So now people find it difficult to pay for what we call vital sign. When you come to the facility, it's done every 6 months. The chemistry checkup to find out if the drug is working. It's an issue because most of our clients are failing treatment. Coming to the facility is an issue. No money for transport. They get to the facility, they are begging for transport to go back home.